The cases that keep me up at night are tough. It's the patients that are just dying from infections that I can't treat. I went into this to try and help people, and the number of people I run across that aren't fixable with the current antimicrobials is disturbing. Because the problem is the biofilm, and the biofilm can't be killed with antibiotics. Like when you go to the dentist and get your teeth cleaned, is they can scrape that plaque off, but as soon as you leave, it starts building back up again, and that is a biofilm. So we know that they can go into surgery and try to wash these joints out all day long. It doesn't work. They can add antibiotics directly into the joint space. They can wash the joint. They can wash anything with the antibiotics. You don't penetrate the biofilm. And so we need a new device, a new treatment strategy that's designed at killing the biofilm.
What we're developing is a new cellular therapy to treat chronic drug-resistant bacterial infections. Has it ever been attempted before? There's a lot of skepticism about whether this would work. Certainly in my lab, people thought it was crazy, but there was a stubborn grad student who insisted on doing the experiments, and it turns out it works. And a lot of compelling data from realistic animal models, all the way from mice up to horses. And when you see these patients that have been treated with this activated cell product, it's really quite compelling.
So we're using an activated cell therapy to treat the most difficult infections. Often these are drug-resistant infections or deep-seated infections that are hard for natural antibiotics or common antibiotics to reach. With our cell therapy approach, we can infuse activated cells that find the infection and begin to resolve that infection using the body's innate immune mechanisms.
I've been fortunate to treat patients in my practice here at the hospital, canine patients. And that was really what I think made me really start to think this was something real.
Validus cellular therapy would give us a tool to allow us to retain the hardware in these patients and eradicate the infection without the patient going through significant disability from multiple surgical procedures.
How successful is it going to be? I don't know yet, but it's going to work. It's going to cure people. It's going to get us. It's going to be another tool in the toolbox. This is potentially Nobel Prize worthy. Let's get it. Because quite frankly, it might be you who has a prosthetic joint that gets infected and you become my patient. And then we're having this discussion in my clinic.